So, Carol, we're really pleased to have you talking at our forthcoming Respiratory Collaborative. You're based in Gloucestershire, I know, so tell us what you're up to at the moment.
So life's interesting at the moment. So clinical work is on hold, but I'm optimistic that will start soon. So I'll be back to doing my Pheno clinic in general practice. I'm one of the respiratory network leads, so that is full on and exciting. I'm PCRS executive chair, so you can imagine the respiratory world is very busy and full on at the moment. And then I've got other interests, like I sit on the NACAP board. I'm one of the UK Lung Cancer Coalition CIC directors, so lung cancer is another of my passions. And then it's those other respiratory things that you get drawn into that are really exciting. So I think that's a sort of a very quick précis of my life.
Yeah, so I said 8-day week, but you corrected that to 9-day week, I think. And with your Pheno clinic, at the collaborative, will you be able to clarify all those mysteries about Pheno for us?
Well, I'm hoping to. So yeah, so Pheno Pheno's been around for a long time. I've Phenotested patients for probably 11 years as part of my routine work. So when I worked in primary care, it was part of my routine asthma toolkit. And now it's the specialist clinic that I do. So I'm hoping I'll have some of the answers in explaining what Pheno is, where it sits in the pathway, and how you can enhance the service you offer your asthma patients by adding Pheno into the toolkit, but using it appropriately, not using it for every patient that comes through the door.
Very wise words. And I note that Phenotesting is now part of the asthma QOF. What do you think about that?
Yeah, so the problem is that not everybody has access to Pheno, and that's a real shame, because I think if Pheno was free, everybody would use it without a second thought. I think one of the limiting factors is cost, and I think it's right that it is in there as one of the potential tests to help to support a diagnosis of asthma. But I think once we can get it across the board and we can get it as access for patients for a diagnosis of asthma, it will be the right thing. And I think the move towards diagnostic hubs may well be the answer. But I think the other tests that are in there are also options. But I think Pheno is one of the really key diagnostic tests in diagnosing asthma, with it being an inflammatory disorder.
And you mentioned that not everyone has access to Pheno, so it's important to note that Phenotesting is one of the rapid uptake products that's been identified, and you're involved in the Accelerating Access Collaborative, as are the AHSN, so that's an important stream of work.
Yeah, and that's giving us the ability to spread Phenotesting, and the aim with Access is to spread it at pace and speed, so that we can actually get it out there, so that people will have access to Phenotesting much more readily than they would previously. And it's a really good, really exciting program. The unfortunate thing is not everybody will get their bids through successfully, but we're also looking at ways that we can really harness the passion and enthusiasm, even for those people whose bids were unsuccessful. So we'll look at other ways of maybe thinking about how we can get Phenotesting out there for the people whose bids even weren't unsuccessful. So if your bid wasn't successful, don't give up.
That's good to hear. So I really look forward to hearing a lot more about Pheno in June. Thank you.
Thank you for inviting me. Thank you.